I chose Griffith University for my degree because after much research, I really loved the flexibility that Griffith offered.
The School of Nursing and Midwifery is ranked number 1 in Australia. What sets Griffith apart is our attention to students, making sure that the student experience is of top quality. We have fabulous simulated laboratories, but also we have very good connections with all our health partners in hospitals and community services. So our students are preferred and highly regarded.
I've always had an admiration for midwives, but it wasn't until I had my first child where I got to see what they do, and that was my big eye-opener, and I went, oh, I've got to do that. That's amazing.
We have bachelor degrees in nursing and midwifery, but we also have postgraduate degrees in a range of areas such as critical care, emergency, infection prevention and control, primary maternity care, and we have also PhDs. In both nursing and midwifery, it's really important that we have theory as well as practical. The theory is so important because you've got to understand why you're doing something to a patient. The practical is we're preparing you to be able to do those practical skills, and we do that in simulated laboratories.
The simulations are great because they replicate the hospital exactly. All the equipment, all the medical supplies that we're using at the hospital are what we have here in the labs. We can get used to the feel of everything and gives us that confidence when we walk into the hospital. The thing I like most about the degree is the relationships we develop with our women. On a shift, you sort of walk through the door, having never met this woman in our family before, and you can leave your shift feeling like they're part of your family, and yeah, that's really beautiful. I love that.